50% thickness tear in the supraspinatus tendon, which is actually the muscle in the rotator cuff that is responsible for external rotation, or one of the three that are.
Wrong, worrying, and wrong again. Hi, welcome back to the channel. If you're new here, my name is Dr. Aziz. I'm a physician in both emergency and family medicine based in the UK. I have a fair amount of experience in sports and exercise medicine as someone who trains and has done so regularly for over 20 years and participated in numerous sports as well as treating thousands of patients. Anyway, in today's video, I'm going to go over a video by Jeff Cavaliere at Athlean X where he received what seems like bad news. Now, it seemed like a bit of a shock to him, and certainly some parts of it are concerning. As someone who's read and interpreted thousands of scans, I'll share my thoughts. There are actually some errors made by Jeff, and I'll point out what they are. We'll also discuss what he is doing right and wrong and how he could possibly adapt his training given the scan results. So Jeff explains how his son slipped on some ice holding onto Jeff's hand and caused some injury and pain for Jeff in his elbow.
He slipped on the ice and I was holding him, and essentially as he dropped down I tried to quickly grab him. Well, I felt this pain in my elbow, and I thought at the time that maybe it was a supinator muscle strain.
Jeff mentioned sensibly he just tried to get on with things before symptoms persisted, and he decided to get an MRI done of both his elbow and his shoulder. Now, a couple of things to mention here. First, most normal people wouldn't just and couldn't afford to jump straight to an MRI scan, a very expensive, a very detailed scan, let alone of two joints. Certainly in the UK, a lot of these injuries are diagnosed clinically, i.e. without scans, and then if necessary, x-rays can be done, then ultrasounds, and between these, most of the injuries Jeff points out in this video can actually be picked up. An MRI is more detailed but not always necessary, and usually done if other scans are inconclusive or if the client has a lot of money to pay for one privately. Secondly, Jeff is right in that joint above the one causing pain should certainly be examined, but from a medical perspective, so should the joint below, in this case the wrist. But there's no mention of the lower joint either in his consideration of cause of injury or getting it looked into via scans. Now, coming on to the scan results, he starts with the shoulder and mentions a supraspinatus tear.
A 50% thickness tear in the supraspinatus tendon, which is actually the muscle in the rotator cuff that is responsible for external rotation, or one of the three that are.
Now again, two things to mention here. Number one, there is quite a significant tear to the supraspinatus, to which he doesn't give too much heed to in this video, mainly because he's not in pain. There is past injury with baseball, he mentions, that may have caused this, but the damage is still present and pretty significant. Secondly, he says the supraspinatus is one of three rotator cuff muscles which externally rotate. This is incorrect. There are four rotator cuff muscles, and supraspinatus's main function is to abduct the shoulder, not to externally or laterally rotate the shoulder.
The infraspinatus and subscapularis tendons are intact.
These two rotator cuffs are actually the ones that are responsible for external and internal rotation, and they are fine. So Jeff mistakenly thinks that the rotator cuff muscle, supraspinatus, he thinks, is responsible for external lateral rotation or damage, and the others are intact. But in fact, it's the other way around.
The AC joint, this little joint at the end of my shoulder here, has a little bit of a spur that's coming down from underneath the joint with some mild AC joint degeneration.
Now, what Jeff has got here is basically arthritis or osteoarthritis. Spur, and I'm surprised this term is used. In the UK, we use the more anatomically correct term, which is osteophyte, is one of four core features of osteoarthritis that can be seen on a scan. The other three being subchondral sclerosis, subchondral cysts, and loss of joint space. Whenever you see the word degeneration, this basically refers to arthritis. Previously, arthritis used to be known as a disease due to wear and tear. We now know it's a more complex process, but certainly one that is still more prevalent as we age.
The glenohumeral joint, interestingly, has some diffuse glenohumeral cartilage thinning, so on the head of the humerus up there, with some osteophyte formation or early arthritis.
Yes, I agree with this, and the more correct term of osteophyte is used in this instance.
So essentially, in non-medical terms, this is saying that I have the shoulder of a fucking 80-year-old man.
So I disagree here. He's probably got the shoulder or degeneration of a 55 to 60-year-old. It is worse than what you would expect for an average 46-year-old, but certainly the imaging of an 80-year-old joint would typically be worse. Now, Jeff goes on to comment about imaging results not always matching up to symptoms.
So a lot of times there'd be imaging that says that things look pretty damn bad in there, but clinically you feel totally fine.
Now, this is true. This can happen, and there is degeneration picked up on imaging before symptoms manifest. Just that most people don't have the luxury of paying for an MRI just to have a peek at one's shoulder, even if they're not in pain.
I've always tried to give you guys the understanding and knowledge. Look, I understand you can learn a tip or two on TikTok in 10 seconds.
Unfortunately, some of the information given here by Jeff is as inaccurate as some of the misinformation on TikTok that he's referring to, I'm afraid to say.
Right, what would you do? Well, if you don't have an actual report or a visit to the doctor yet, I think you should start there.
Yes, I'd agree.
Your doctor says, because it's the easier recommendation to make, listen, don't do anything right now, let it calm down, I'll see you in 4 months. I don't think that's the best approach to go.
So he's recommending you see a doctor, but then don't listen to the doctor. Rather listen to a man who, in his own words, has managed to wear his 46-year-old shoulders down to an 80-year-old's. Yeah, that doesn't make much sense. If you're advised by your doctor or an orthopedic surgeon to rest, it's for a good reason. Just because you or Jeff or anyone else doesn't have symptoms yet doesn't mean you won't soon enough unless you treat the underlying issues.
Finding the right exercises, this MRI report becomes a hell of a lot less meaningful. Because once you have the exercises that are able to be done, you continue to build them up.
So Jeff goes on pretty much the rest of the video about how basically just to listen to your body and keep pushing yourself, right and wrong. Yes, listen to your body, but when you know categorically that there are deficiencies or injuries or degenerative changes, as there are in this case with Jeff, something he seemingly had little clue about, or at least the extent of which until he got his MRI scans done, then you need to adapt your training. He may be fine now, but sooner or later if he keeps pushing himself, exercising every day as he mentions.
I come into this gym every single night, 10 o'clock, 10:30 after I put the boys to bed, and I train hard, and I feel great. And I don't have the limitations that the MRI is suggesting that I have.
So no rest days, he trains every day or every night, he trains hard, pushes himself. Jeff later goes on to say he's doing all this and his channel to educate others.
I keep going, and I'm able to keep going and have good energy and be able to attack my workouts and make the right decisions along the way because I've allowed myself to become more knowledgeable.
An area of medical knowledge Jeff does not seem to have is that if you have radiological evidence of degeneration, you will more likely sooner or later experience pain and discomfort. In one particular study in 2010 in the Journal of Musculoskeletal Science, groups were routinely imaged to see whether those that showed signs of arthritis on imaging differed from those that didn't. The results? Those that demonstrated signs of arthritis on x-rays experienced pain earlier and to a greater severity than those that didn't. It'll be interesting to see how much longer he can keep going. I don't think he'll do a Jack LaLanne to the age of 95. I think he'll start struggling within the next 10 years, to be honest. If he doesn't introduce more rest days, if he keeps advocating exercising the same muscles every day, face pulls every single day and every single workout, no wonder his shoulders are in severe degeneration, and that of a much older man. Now don't get me wrong, I think there's a lot of great stuff on Jeff's channel, having watched a huge amount of his channel. There are however some aspects, including the advice and mistakes mentioned here in this video, that are at times dangerous or at least very concerning. Jeff does a lot of great stuff, and like all humans he makes mistakes too. What I find concerning is that he rarely if ever corrects his mistakes, from the fake weight scandals to some glaring misinformation from a scientific perspective. I have considered putting a compilation together of medically wrong information put out there by Jeff Cavaliere, but we'll see. He's clearly very popular and there will be a backlash from his diehard fans. Anyway, what are your thoughts? Have you experienced any injuries? Post your experiences and comments down below. Until next time, stay safe.